Congenital cytomegalovirus is actually human cytomegalovirus that is transmitted from a pregnant mother to her fetus at some point in her pregnancy. In severe cases of celiac injury or illness, it can cause organ failure, profound hearing loss, and in the worst cases, result in death. CMV is the abbreviation for cytomegalovirus, whether we're considering human cytomegalovirus infection or a congenital infection. It has been found that 1/3 of children under the age of 5 have had their first or primary infection, and up to 90% of individuals that have reached the age of 40 have experienced a primary infection. Traditionally, CMV is actually a rather benign virus and doesn't typically affect children and adults the way it does congenitally infected infants, but studies have shown that in immunocompromised individuals, they can sometimes have flu-like symptoms like cold, cough, and fever. CMV, however, becomes a different ballgame for fetuses, newborns, and infants when their mother, who has never come in contact with the virus prior to the pregnancy, acquires a first-time or primary infection when she's pregnant. The earlier she acquires the infection in her pregnancy, the more dangerous to the newborn infant and fetus. It was previously believed that only a pregnant woman that was having their primary infection could transfer it to the fetus, but it's now been shown that up to 1.2% of mothers that are pregnant can in fact have a recurrent infection because it is within their system or witness a new strand and transfer it to their baby. In the United States, 1 in 200 infants will be born with congenital cytomegalovirus, and 1 in 5 of those infants will have lifelong complications as a result of the vertical transmission of human cytomegalovirus from the pregnant mother to the infant. It can be difficult to predict whether or not a baby is going to be born symptomatic to CMV, which often results in microcephaly, which is a decrease in head circumference, liver failure with petechia, and in the most extreme cases, unfortunately, it can also result in death. And then sometimes you have asymptomatic congenital CMV babies, where at birth they look and sound and act completely normal and have no obvious complications as a result. However, they have discovered that hearing loss is the most common side effect of congenital cytomegalovirus for asymptomatic infants. CMV hearing loss can be a bit complicated no matter whether they are born symptomatic or asymptomatic, but it's been proven that even babies that are born with normal hearing, up to 65% of them will experience sensorineural hearing loss, and many of them do unfortunately go through profound hearing loss by the age of 13. These are actually my identical twin infants that were unfortunately infected with congenital cytomegalovirus. One of them was born with completely normal hearing, and the other one was born with severe hearing loss on both sides that eventually progressed to profound hearing loss. And the doctors tried to administer antivirals to negate some of the side effects of CMV after birth. Unfortunately, the antivirals that the doctors currently use to try and negate the side effects of CMV can have very serious side effects. And much like my twins, many developed leukopenia. My twins developed near fatal leukopenia and had no immune system. But it's why I bring up there is no universal testing for pregnant women or newborn infants for CMV. Although there are clinical trials going on to try and treat pregnant women that have been found to come in contact with CMV while they are pregnant, antivirals are having some success with pregnant women in negating the severity of transmission. There is no treatment that is FDA approved for the treatment of congenital cytomegalovirus. In addition to clinical trials for pregnant women and newborn infants, they are currently trying to develop a vaccine to help eradicate the risk of CMV globally because it is such a prevalent and common virus, and most unfortunately an unheard of virus a lot of the times until a mother gives birth to a congenitally infected CMV infant. Unfortunately, scientists and doctors have found difficulty in developing a successful vaccine because not only is there the wild type CMV virus in the environment, they've discovered up to 17 different variants of cytomegalovirus, and it makes it a lot more challenging to develop a successful vaccine. What the CDC recommends is that you focus on hygiene when you are pregnant, especially if you don't know if you've had a primary infection, and to be aware just in general that CMV whether human or congenital, can be transmitted through body fluids, blood, and organ transplants. One of the things I wish I had known is that young children, like in a daycare facility, are the largest population to actually spread cytomegalovirus to a pregnant woman that has never come in contact with the virus. So doctors recommend extra hygiene practices and actually avoiding those circumstances if you can when you are pregnant. In addition to young children being the highest risk to spread CMV, the highest risk pregnant women that have never had a primary CMV infection are women under the age of 20 and women that work in the healthcare industry, because obviously you're around a lot more body fluids and sick people that could have CMV without you being aware. One of the biggest things about congenital CMV is that there is no awareness. I was not aware of congenital CMV, the risk, or the dangers until the second day of my twins' birth. And even though the CDC is doing their part to spread the word, community word needs to be spread to individuals as well. Sometimes I wonder if I would have contracted the cytomegalovirus and passed it on to my twins had I been educated on the risk of a primary CMV infection from my OBGYN or any other facilitators in the medical community. So I do try and push for CMV education whenever I can to let people know. So overall, I implore people to talk to the doctor if they are planning on getting pregnant about a primary infection of CMV, if they suspect they've come in contact with it with cold or flu-like symptoms. And I kind of urge the community and people to help encourage legislation, education, and awareness on congenital cytomegalovirus.